Hello all. Good morning and good evening for all Indian participants. Good morning for outside India, especially US participants. Welcome all for this uh, specific talk on how to prevent, control, and treat high blood pressure without medicine from Dr. Susheel Sharma. We'll start in few minutes. We'll wait for some more time. We are expecting more participants to come in. In the meanwhile, we can have some more details about the program and this organization. This IWSP stands for Integrated Wellness Science and Practice. We are into wellness, integrated wellness. We have this one of the premium course called Holistic Wellness, that is lifestyle modification. We do have physiotherapeutic yoga remedies for musculoskeletal disorders, especially the back pain and all work-related issues. We do have a course. And apart from this, we do offer daily yoga programs for beginners, and then specific therapeutic yoga for specific individuals on one-on-one basis. So these are all the 4 different offerings we have at this point in time under this umbrella of integrated wellness science and practice.
Health and wealth.
Just listen to this video. It will give you how important health is, as we belongs to integrated health and wellness, function. Just this will give a little more clarity on how important health is.
Health and wealth are related in many different ways. First, there is the sheer cost of unhealthy habits. Eliminate a $10 a day smoking or junk food habit, for example, and you can save $3,650 annually, plus interest. That's just the immediate savings. There are also savings over the long term for the rest of someone's life. The Centers for Disease Control in Atlanta, USA, estimates that a 10% weight loss could reduce an overweight person's lifetime medical costs by $2,200 to $5,300. Delaying the onset of diabetes can save thousands of dollars annually in increased medical costs. Come and visit myiwsp.com and register for a nominal fee to get rich. Give it a shot. You will thank us, we promise.
Just to create an awareness how important health with respect to in relative terms of wealth. So let us get into today's talk. Today's talk is going to be how to control high blood pressure, prevent, reverse, control high blood pressure without medicine. The facilitator is going to be Dr. Susheel K Sharma. He is already connected and joined with us live. Many of you might be aware of him, that he is a board certified interventional cardiologist with 40 plus years of professional experience. And now in our later part of his career, now he is dedicating his life for wellness. So he's a very renowned wellness coach, being a interventional cardiologist, and has got a good deep knowledge in yoga, meditation, pranayama. And then he showed a lot of interest, and he's showing a lot of results in his journey of wellness coach now. So let us hear from Dr. Sharma, and then we will have a Q&A wherein he is also available. He will answer all our questions. Any questions comes when he is talking, please put them in your chat box. We will take those questions answered by Dr. Susheel at the end of his talk. Let us quickly move on to his talk.
Thank you, Namaskar. Thank you very much. That was a kind introduction, and good morning and good evening and good day too, depending upon wherever you are. So today we're going to do one segment of the lifestyle disorders, and we are going to talk about high blood pressure. Now, high blood pressure, you may either have it, or your family members or parents or grandparents may have it, so you know about it. If everything that I'm going to talk today, everything you forget, but if you remember 3 things, I think that you've done yourself a service. Number 1 thing, once you finish this talk and go away, remember for the rest of your life that blood pressure is a silent killer. It may not give you a lot of grief. Your blood pressure may be 170, 180, 190, or 200, and you may not notice any symptom. But over a period of time, it is causing changes in your system that then leads to shortening your lifespan. So that's number one. Remember, blood pressure is a silent killer, and therefore you must take care of it. Number two, sometimes there may be a cause for blood pressure, 4 to 5% of the time. 95% of the time, your doctor may tell you, yeah, you have blood pressure, your father had blood pressure, your mother has blood pressure, there's no cause for it. Well, we disagree. We think lifestyle is the cause. And that's number two thing you need to remember. The number three thing you need to remember is that if you transform that lifestyle in a scientific manner, as we recommend based upon our program, you can either prevent or cure or treat your blood pressure without medicines. I'm not asking you to stop your medicines. Keep taking your medicines for now, and also join IWSP and do the program and gradually make the transition. Over a period of time, your medications will go down and your blood pressure will come down, and you can either come off of medications completely or reduce them. So remember these three things. One, blood pressure is a silent killer. Therefore, no matter what, you have to bring it down if it's high. Number two, it's a lifestyle disorder. And what is lifestyle? Lifestyle is the way you live, the way you move, the way you eat, the way you think. And if you change these four, you change your lifestyle. And by changing lifestyle in a structured, scientific manner, as we have put together and packaged in this program, you can either prevent, control, or cure your blood pressure. Okay, so I thought, let me get the meat, the gist, the butter out of the way, and then we'll talk about rest of the things. So let me share my screen with you. So I already gave you a brief description of lifestyle disorder. This is one of the lifestyle disorders. And one thing you need to remember is this. Remember this 80% rule. And what is this 80% rule? The 80% rule is that 80% of us at some or other time in our lives will have this lifestyle disorder. So what are these lifestyle disorders? High blood pressure, overweight, dementia, chronic kidney disease, heart attack, high cholesterol, diabetes, stroke, and some cancers. These are all lifestyle disorders. You may think, oh my God, there's so many illnesses, and you see them all around you in general public, in your family, friends, you hear it all the time. And Dr. Sharma is telling us that they're all lifestyle disorders. And 80% of us, 4 out of 5, including myself, will have one or more of these at some or the other time in our lives. So this tells you about how prevalent this is. Well, one more thing you need to know, 80%. Some of us may die from an accident, okay? Some of us may die for some other cause, but 80% of us will eventually die because of a direct or indirect consequence of one or more or all 8 of these disorders. So for example, I may die of a heart attack one day. Yes, lifestyle disorder. Or I may go into kidney failure, may get a kidney transplant, it may not work, and I may die, lifestyle disorder. I may have diabetes, I get complications of diabetes, I get severe infection, I get kidney failure, I lose my vision, I get septicemia, and I die from septicemia. But eventually, it was diabetes that led to it. So the cause was lifestyle illness, or I may die of stroke or some cancers. Also, if you really look at how the health budget is done, and this is especially data from Medicare from the USA, 80% of our health budget is spent on managing these 8 disorders or their consequences. If you really look at, you go to your grandfather and go to your grandmother sometime and look at all the medicines that they're taking, almost all of them may be taking one for the blood pressure, beta 2 for the blood pressure, one for the cholesterol, 1 or 2 for the diabetes. So 5, 6 medicines that they're taking, because these are lifestyle disorders clustered together, and lifestyle causes one and more of these disorders depending upon how you lead your life. And then they have to take all these medications, which are expensive, doctor's visit, blood tests, hospitalizations. And if complications happen, then procedures and surgeries, right? So all these expenses, if you add up, because when you're in your 10, 20, 15, 30 years old, you hardly spend anything on your health, right? There's hardly any expense. It's only when you get to the latter part of your life and you get these lifestyle disorders and they start causing complications and physician visits and all that, that's where the money is spent. So 80% of an entire health budget will be spent on these disorders. So imagine how much money you could save by preventing these disorders. And blood pressure is one of them. But now the good news. The good news is that 80% of these 8 lifestyle disorders can either be managed, cured, or improved with scientifically proven methods for lifestyle transformation. The methods have to be scientifically proven, not somebody's gut feeling. Scientifically published in world literature, shown to make a change by changing the lifestyle in these disorders. And that is what our program is. And that is how we manage these lifestyle disorders. So this is a bit of good news that 80% of these lifestyle disorders can be cured, managed, or improved. Okay, so blood pressure. So what is blood pressure? Let me just first go in a very layman terms. The many types of pressures you know, right? Your car tire has a pressure, right? You put air in it, and that's pressure. You need that to keep it inflated. Now, you also know that too much is not good and too little is not good. There's an optimal pressure depending upon the size of the tire and the size of the vehicle. They recommend 40 psi, 36 psi, 46 psi, right? And psi is a measurement of the air pressure in a tire. Now, same way in the body, there are blood vessels and the blood flows in them, and there's a pressure that it flows under, and we call it blood pressure, which we measure in millimeter of mercury. Now, how does the blood flow? So let's first take the example of a building. You live in a 5-story building, right? For the water to reach 5th floor, you need a pump, right? Something to pump blood up because it has to go against gravity. And that is the function of the pump, and the equivalent of that pump in your body is your heart. So that's one thing that is required for blood pressure. The second thing is the pipes. The water cannot reach the top of the building just by the pump. It has to go through the pipes. And these pipes are the blood vessels. So in your body, exactly the same way, there's a pump, which is heart, which pumps all the time, right? And there are pipes through which the blood runs. Now, when the blood runs through these pipes, it runs under pressure. If there's no pressure, the blood cannot go up because the gravity will pull the blood down and all the blood will go in your feet. That pressure, 120 divided by 80, 120 over 80 millimeter of blood pressure is called the normal blood pressure. So why do we say 120 divided by 80 or 120 by 80? Well, you have to think about it. When the heart pumps, when it squeezes, the Latin word for the squeezing is systole. So when the blood squeezes, there's a higher pressure, and that's the upper pressure. It is called systolic pressure. And then for the heart to pump, it has to fill again, right? So it relaxes and fills. The relaxation of the heart is called diastole. So during relaxation also, some blood flows, although not at such a high pressure. And that's lower pressure is called diastolic. And that is why we say you need 2 pressures. One when the heart squeezes, one when the heart relaxes. And this is going on all the time. Systole, diastole, systole, diastole, systole, diastole. So systolic pressure, diastolic pressure, systolic pressure, diastolic pressure. Both are equally important. You have to keep systolic around 120 and diastolic around 80. Okay, so we're on the pipes, right? You understand if something flows in the pipe, the flow is a function of the quality and the quantity of the liquid flowing in the pipe, right? So if, let's say, you have a pipe through which very corrosive, dirty water goes, this pipe is going to rust, corrode, and going to get damaged. It's exactly the same way. If the blood that is flowing through your arteries is not good, loaded with fat, loaded with sugar, loaded with salt, what is it going to do? It is going to corrode the inner lining of your blood vessels. They will lose their elasticity. They will not be able to accommodate higher pressure, and the blood pressure will go up. So this is how you make a connection between a poor diet full of salt, sugar, and fat, eventually contributing to damage to the inner lining of the blood vessel, and causing high blood pressure. So that's the quality of the blood. Quantity also matters. Generally speaking, in our body, we have 5 liters of blood. And this 5-liter blood is moving in a closed space by this pump. Now, those of you who have done physics will know what will happen if I expand this volume from 5 liters to 6 liters. Same blood vessel, closed loop, same heart, same body. From 5, it became 6. Now, when the volume increases, some of you may remember from physics, pressure is also a function of the volume. So when the volume increases, the pressure has to increase. There's a greater volume to push through. So how does the volume increase? Let's say you have 5 liters of blood in your body and you consume 10 grams of salt. Now remember, 10 grams of salt can come from actually 3 slices of pizza, right? Now this 10 grams of extra salt or sodium that went in your body, got absorbed, got in your bloodstream. It raises your sodium levels. Sodium is generally kept around 130 to 135 milligrams level. Now, if the sodium goes high because it's dangerous, what does the body do? Body will say, okay, let me get some more water in to dilute this sodium so that I bring the level down to 130 to 135 milligrams. So how does the body dilute? Body dilutes by preventing you from losing fluid, by not peeing out or sweating, and by increasing the blood volume. So if you took more salt, the consequence of that is sodium went up. Sodium went up, you retain more fluid. You retain more fluid, you increase the blood volume. You increase the blood volume, you increase the blood pressure. So that is how sodium or salt is directly correlated to blood pressure. Okay, so it is a continuum. So one more thing, remember I told you 3 things to remember when you go away from this talk, and if you forget everything, 1, I told you, it's a silent killer. 2nd, it's a lifestyle disorder. Number 3, it can be cured or prevented or managed by changing lifestyle. I want you to remember one more thing. For every 1 millimeter rise in your blood pressure above 120 millimeter of mercury, your risk of stroke goes up by 2%. So if your blood pressure goes up by 25 millimeter and stays up at 145, 150, you have a 50% chance of getting a stroke compared to a normal person. So this is how exponential the risk of getting the complications from the blood pressure is. And that is why I say it's very important to treat it. So now this is controversial, what I'm showing you right now, because this is the new data that has come out. This is the latest recommendation from the Hypertension Society of America. And this is also from the American College of Cardiology and American Heart Association. This came out in 2017 and still holds true today. There has not been a revision. And there was a huge hue and cry when this came out. Why? Because look at that yellow segment, which says from 121 to 129 systolic is elevated blood pressure. So what did this mean epidemiologically? What this meant was that 1 in every 3 Americans has high blood pressure. Now, the critics said, oh, well, this is a plot by pharmaceutical industry to push medications to bring the blood pressure down and sell their medicines. So these are the skeptics who interpreted it this way. Well, this is based on science. It's based on science because every 1 millimeter rise in blood pressure above 120 has a consequence. So I look at it differently. I look at it, it doesn't matter whether it's 129, 139, 140, or 150. I can lower this blood pressure by lifestyle. So I don't think it's pharmaceuticals pushing this because I'm not taking pharmaceuticals. I am doing lifestyle change. So it's a good information to know that you have to keep your blood pressure below 120 systolic or 80 diastolic. If you are 120 to 129 systolic, you are elevated blood pressure. So if you're 130 to 139, it's already called hypertension stage 1. Now, most people, those who are listening in India or some here going to their primary care physicians may know that usually physicians start medications if the blood pressure is 140 or higher systolic or 90 or higher diastolic, which is actually stage 2 of hypertension. You've already gone way beyond. So what 10 years ago we used to say 140 over 90 is normal blood pressure, now is stage 2 blood pressure. So try to understand this. It's very important for you to know that anything above 120 over 80 should alarm you. You need to change something to bring your blood pressure down. Don't procrastinate. Don't sugarcoat it. And please don't do, I've been treating blood pressure for 40 years with my patients. They come in and the blood pressure is 150 over 94. Well, doctor, this is unreal today. Remember, I drove 20 miles to come here. I couldn't find the parking. And before I came in, I couldn't find the gas station and I was frustrated and my credit card didn't work. And at work, my colleague was not very good to me. At home, I had some argument with my wife. Last night, I had some argument with my son. These kind of things normally don't happen, doctor. When all these don't happen, trust me, my blood pressure is normal. Then I ask them, how many times does it happen the credit card didn't work or the gas station or the argument or colleague or all that? Every day, one or the other thing happens in our life which is stressful. So don't just sugarcoat it. Don't just blow it under the carpet. Don't procrastinate. If your blood pressure is 150, it is 150. It is causing damage to your heart, damage to your body. Now, there may be a secondary cause, a stress. But the important thing is you are being damaged. So you either have to learn how to control stress or bring this blood pressure down. And that is what we tell you. We tell you lifestyle to bring the blood pressure down. And we tell you how to manage your stress so that it does not affect your blood pressure. Okay, so we discuss in detail what causes high blood pressure, but I'll just enumerate here one more time. 5% of the time, there is what we call secondary cause. Secondary means either some endocrine disorder, such as high aldosterone levels or cortisol levels, or some kind of chronic kidney disease that can cause blood pressure. So that's about 5% of the time. In 95% of the time, there is no such cause, and that is what we call as essential hypertension or primary blood pressure. And the doctor will tell you, well, your father had it, your mother had it, and therefore you have it. And when you become older, you have a chance of having it. Yes, it is primary, it is essential. There is no cause for it, but remember, I told you there is a cause for it. Because if you change your lifestyle, this blood pressure goes away. If the blood pressure goes away with the change of the lifestyle, then lifestyle was the cause of the blood pressure. So what happens? See, there are blood vessels going in every part of your body. The blood vessels going in your brain, right? If they become narrowed, constricted from high blood pressure, the inside gets corroded or damaged, you have memory loss, you can have strokes. If the blood vessels going to your heart do not provide enough circulation, you can get heart attack, you can get enlarged heart, you can get heart failure. If the blood pressure causes the blood vessels going to the kidney become damaged, then you get kidney failure. If it causes problem to the arteries going to your legs, then you get peripheral vascular disease, because these blood vessels are going everywhere, and the pressure inside the blood pressure determines the quality of the blood vessel. If the pressure is high, the quality is poor. If the quality is poor, the appropriate organ which is being supplied by these blood vessels will suffer the consequence of that problem. Okay, so how to control, prevent, and cure blood pressure? There's no doubt you have headache, right? You check your blood pressure, you have high blood pressure. Your doctor says, okay, I checked your blood pressure and it's 145/90. I think I have to give you a medicine to treat blood pressure. Simple. You go there, it writes a prescription, you take home, you start taking one medicine. Well, sometimes it may not be 145/90. It may be 160/100. So remember, one medication for blood pressure that your doctor prescribes lowers your blood pressure by 10 to 15 millimeters of mercury. So if you're 145, you take one pill, you come down to 130. But if you're 160, you're going to end up needing two different types of medicines, because remember, each one lowers by 15 millimeter. So to bring it down from 160 to 130, you will need two medicines. Now, if it is 175 or 110, you will need another medication. So if your blood pressure goes to that range, you're taking 1, 2, 3 different medicines. Now, some of you might say, okay, doctor, that's fine. I have high blood pressure. I can take one medicine. I can take 2. I can take 3. I bring my blood pressure down to 120/80. Why should I worry about your lifestyle? Right? Well, there are many reasons for that. Number one, when you take medicines, you're spending money. Number two, when you take medicines, you're making frequent visits to the doctors and getting blood tests. You're spending money and time. And when you take these medicines, you're spending money, spending time, and you're suffering the consequence of the side effects of these medications. So I'll tell you a very simple thing. The most common medicine used to treat blood pressure is called hydrochlorothiazide or chlorthalidone, or in short, we'll call it diuretic. It is called diuretic because it removes sodium from your body. And remember, I told you, when the sodium goes in the body, salt goes in the body, water goes in the body, blood pressure goes up. So the theory here is that if you remove the salt from the body, right, and you bring the volume down, you treat the blood pressure. Very good, excellent medicine. It works 100% of the time for bringing the blood pressure down by 10 to 15 millimeters of mercury. So let's say you say my blood pressure 140/90, doctor. I don't want to do any lifestyle change. I don't want to restrict my salt. I will just take one hydrochlorothiazide. You're telling me zero salt or no salt, and I'm getting the same thing by taking a medication. You can take this medicine and take the salt out of the body, and then I can eat my samosa, I can eat my chaat, I can eat my salty food, everything, right? What's wrong with that, doctor? Right? You can ask me that question. Here is the problem. Hydrochlorothiazide is a medicine that reduces sodium, reduces blood volume, treats blood pressure, but every effect that a medicine has, there's also, along with it, there is a side effect. So let's say you took hydrochlorothiazide and 6, 7, 8 months later, you went to your doctor and the doctor says, now your blood sugar is high. You say, oh, blood sugar high, what happened? Doctor, nothing changed in my life. Why should my blood sugar go up now? Well, I didn't tell you when I prescribed hydrochlorothiazide that 10 to 15% of patients can have hyperglycemia as a side effect of hydrochlorothiazide. So it is a side effect of this medicine that you're treating for your blood pressure. But the medicine is doing very good for your blood pressure. So don't worry about it, okay? Keep taking your hydrochlorothiazide. This side effect of hyperglycemia that has come, I will give you one more medicine called metformin, and they'll bring your blood sugar down. And I'll give you glipizide, and they'll bring your blood sugar down. Now you're up to 3 medicines. You go back to him 2, 3 months later, your blood pressure is okay now, and your diabetes is okay now. And he says, well, your triglycerides are going up. He says, doctor, why is that? Nothing has changed. My diet is same. I'm exercising. I'm taking medicines. Why is well, I didn't tell you that actually hypertriglyceridemia happens in 10 to 15% patients that take hydrochlorothiazide. So it's a side effect of a medicine. But don't worry about it. I can give you fenofibrate, 145 milligram. Here's a pill, take it, and your triglycerides will be fine. So now you're taking hydrochlorothiazide, you're taking metformin, you're taking glipizide, and you're taking fenofibrate, right? 4 medicines. Everything is fine. You go back 3 months later and say, doctor, I have this severe pain in my right big toe. What is this? And I can't even touch it with my socks. It burns. And he looks at it, it's inflamed, it's red. Oh, this is actually gout. It's gout. Gout? I never had gout. I never had any problem called gout. Well, I didn't tell you this, but 10 to 15% of patients have a side effect of this medicine, hydrochlorothiazide, called hyperuricemia. It makes your uric acid go up. So he checks your uric acid, it's 10 milligrams. So, well, here it is. Take some Motrin to bring the inflammation down, and take this colchicine and take this medicine to bring the uric acid down. So now you're taking 1 for blood pressure, 2 for diabetes, 1 for triglycerides, and 2 for gout. You're up to 7 medicines. Now, let's not go further, because each one of those medicines that you're not taking have their own side effects. And they'll explain to you why your 70, 80, 90-year-old grandpa or grandma every morning picks up like 8 or 10 medicines and pops them up. So is that what you want to do? If you want to do that, perfectly fine. But I think the very reason that you logged into this program is this is not what you want to do. You belong to the other group. The other group says that why can't I change my lifestyle and bring this 145 or 90 to 120 or 80 at the first place to avoid all these that I went through, the medications, the effects, side effects, testing, and all these consequences and complications, right? So this is a slide that I got modified from American College of Cardiology, American Heart Association. This actually will open your eyes. So please stay with me and pay very close attention. Every 1 kilogram weight that you lose drops your blood pressure by 1 millimeter. So that's 5 millimeter of blood pressure you can lose by losing 5 kilograms. It's good to lose more, but you don't lose more blood pressure after that. If you change to the diet, what we call scientifically proven diet that we recommend in our IWSP program, you lower your blood pressure by 10 millimeter of mercury. Remember when I showed you the effect of medications? 1 blood pressure medicine lowers the blood pressure by 15 millimeter of mercury. So by losing 5 kilo weight with our diet and taking our diet, you lost 15 millimeter of mercury. So if you were taking 1 medication for blood pressure, because your blood pressure was 145 or 90, that medication is gone. Okay. If you bring your sodium, salt, down to less than 1.5 grams a day, your blood pressure goes down by 5 millimeter. If you replace to potassium salt, and we'll discuss in detail how to do that, don't just go ahead and do it without actually attending the program, because some people can be hurt by it. You lose another 5 millimeter. And if you do 20 minutes aerobic exercise a day, you lose 5 millimeter. So 5 plus 5 plus 5 is 15. So now 1 more medicine gone. So if you're taking 2 medications and you did our program and learned the diet, the proper way of salt restriction, potassium, exercise, weight loss, 2 medicines are gone. Okay. If you did dynamic resistance and isometric resistance exercise, each one makes you lose 5 millimeter. And if you quit alcohol, it makes you lose 5 millimeter. So that's another 15 millimeter. So think about it just by doing a lifestyle change as we recommend. And we'll tell you in detail what is aerobic, what is dynamic, what is isometric, and how to do it. You lowered your blood pressure total by 40 millimeters of mercury. That is like giving up 3 medicines. So you have a choice. You have a choice to attend our integrated wellness science and practice program. Learn the scientifically proven techniques published in scientific literature that treat blood pressure without medications and have a healthy lifestyle. Now, that healthy lifestyle that I'm talking about that brings your blood pressure down also brings your cholesterol down, also brings your obesity down, also cures your diabetes, also prevents heart attack, also prevents stroke, chronic kidney disease, dementia, and some cancers. All 8 lifestyle disorders are affected by that.
Thank you, Dr. Sharma. That was wonderful explanation on blood pressure. There are a few questions we have. We'll take one by one. Yeah. How to reduce a high BP instantly?
Okay, thank you for listening, and I apologize for some glitches, the technical glitches in transmission and sound and picture quality, but I hope you got the gist. So you really do not need to bring the blood pressure down very quickly unless it's an emergency. For example, you have a bleeding in your brain like subarachnoid hemorrhage or cerebral hemorrhage, or you have a dissection of major blood vessel called aortic dissection, or you're in heart failure called congestive heart failure, acute left ventricular failure, or you are pregnant and you have eclampsia or preeclampsia where the health of the fetus can be affected. So leave aside these 4 emergency situations. You really don't need to panic and bring your blood pressure down in 2 hours or 3 hours or 4 hours. You can bring it down gradually by doing these lifestyle changes. So you don't need to bring this blood pressure down if you're not having any symptoms or you're not having those conditions.
Another question linked with the low BP. Can people with low BP use compression stocking for legs and arms to improve circulation?
Yeah, that only helps marginally by pushing some blood pressure up into the systemic circulation. More effective really is salt. So if you're somebody who has a very low blood pressure, the best way to bring blood pressure up is by taking more salt. You can just take salt tablet if you're in America, but if you're in India, you can just salt up your food more. Just add more table salt in your breakfast, lunch, and dinner. And once the salt goes up in your blood, in a system, as I told you, it will retain water, it will expand your blood volume, and your blood pressure will go up. So for those who have high blood pressure, now you can understand. If your blood pressure is 90 systolic, right? So I'll tell you, my blood pressure normally stays around 106, but lately I've been doing this very intensive diet, and my blood pressure actually came, and also exercise, came down to 90 systolic, very low. So sometimes I felt a little lightheaded, but then for a week I went away somewhere where I had no control on my diet, and I found out the diet was high in salt, and I checked my blood pressure, it was 106. So my blood pressure went up by 16 millimeters of mercury in 1 week just by going on a diet which was high in salt. So the answer to low blood pressure is salt. Drink plenty of fluids, take more salt, anticipate situations where you are going to lose fluid. For example, if you're going to go hiking on a sunny day, a hot day, fill up your tank. Make sure you eat salty food and then drink at least 2-3 glasses of water before you begin the activity. And during the activity, make sure you take your water bottle with you. So the answer to low blood pressure is salt and water. And the answer to high blood pressure is less salt and less water.
Another question, Doctor, in your talk, you talked about 5 liters of blood in human beings body. Is it common for anybody with the different weight conditions?
Yeah, it varies. I just gave you a general example of 5 liters of blood in a 70 kg man, 5 feet 8 inches tall. So again, you can see somebody who is 6 foot tall and weighs 120 kilos, his blood volume is going to be different than somebody who weighs 50 pounds and is 5 foot 2 inches tall. So it's body weight and body size dependent, but I just gave you a ballpark figure for an average adult.
Is it common for people who are lean will have a low BP?
It is, well, it really is not related to leanness, but some people tend to have low blood pressure. The good news is that the lower the blood pressure, longer you live. So in a way, it's good to have low blood pressure. The only consequence of low blood pressure is when you bend down to pick something and get up, you may get a little lightheaded. So that is the consequence of the low blood pressure. But you can manage that with salt and fluid. So in of itself, low blood pressure is a good thing. And exactly for the same reason, the lower the blood pressure, the longer you live.
Can we stop taking tablets once we follow the lifestyle modifications? How can we decide this?
So that's a good question. I think that you have to go through a very intelligent titration process. So you start taking your lifestyle, changing your lifestyle. Obviously, you're not going to change in one day. So do not stop any of your blood pressure medicines. I hope that all of you who have high blood pressure have a good blood pressure instrument at home and you check your blood pressure on a regular basis. So once you institute the lifestyle change, make sure you check your blood pressure every other day for a week, 2 weeks, 3 weeks, and you will see a trend. It's coming down, 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 down. When it starts coming down, at that point, you can either by yourself, if you drop consistently 10 to 15 millimeter of mercury, eliminate one tablet, or consult with your doctor and tell him that, look, you're doing this lifestyle change. It is going to bring your blood pressure down. You've already brought it down by 15 millimeter. Can I stop one medicine? And likewise, the second and the third. But it is going to be a gradual process, slow process, by careful monitoring, if possible, in consultation with your physician, knowing full well that once you drop the blood pressure by 15 millimeters of mercury, you can drop one type of medicine of blood pressure.
Is a little high BP normal for aged people, like in their 70s and 80s?
Yeah. So again, I told you there's a linear correlation between complications of high blood pressure and the blood pressure. So if you want to have a little complication or a little problem or a little decrease in your lifespan, then little increase in blood pressure is okay. But if you want to have an optimal lifestyle and you do not want to have any complication, do not want to have any problem from blood pressure, then 120/80 is your goal.
What is the reading for low BP? Is it 90/65 is called a low BP?
Yes, so anything below 100 systolic is called low blood pressure, and anything below 70 diastolic is called low blood pressure.
Okay. Can forced breathing or slow breathing practices changes your blood pressure?
Yes. So all the pranayamas, when practiced over a period of time, will reduce your blood pressure predominantly by controlling your anxiety. They control blood pressure. So when you have very high blood pressure acutely, you should at that point not really do the intensive pranayamas like Kapalbhati and do it like 200 times a day. At that time, you just start with Anulom Vilom, right? Simple pranayama, and do slow, deep breathing to bring your blood pressure down. And once the blood pressure comes down and is controlled, then you can add other pranayamas. Yes, all pranayamas eventually will help you to control your blood pressure.
Okay. What is the effect of rock salt intake? Maybe you can elaborate a little more on salt analogy, Doctor, here.
So salt is salt. All salts are salts. So remember this. Do not fall in this trap that any one salt is better or different than the other. If you look at all the salts across the board, per gram of salt is about 32 milligrams of sodium in each salt. Now, some may have 2 milligrams less, some may have 2 milligrams more. For example, your mineral salt, very popular in India, called Sendha Namak, or the rock salt or the pink salt, is about 2 to 3 millimeter less, but it still has 28 to 29 milligrams of sodium. So this very wrong notion circulating that if you switch from one salt to the other but keep taking the same amount of salt, your blood pressure will get better is absolutely wrong. So don't fall in the trap that just because you switch to your salt, your blood pressure will come down. It's exactly the same way as I say in my program. When you attend the program, that a sugar is a sugar is a sugar. So whether it's a sugar, white sugar that comes in a jar, or it's what you call jaggery, the gur, or it's what you call as crushed jaggery, the shakkar, or honey, they're all same. They're all same amount of sugar in each one of them, and they have same effect on your body. So salt, rock salt, sea salt, pink salt, Himalayan salt, rock salt, all salts are salts, and they will increase your blood pressure.
Mr. Subramani saying that thanks for explaining lifestyle modification and reducing the tablet gradually based on our blood pressure. He's thanking. Is there an effect on heart rate with variation in BP?
Yes. So the way your circulation is controlled is a function of two parameters, your blood pressure and your heart rate. And the two interact very closely. And also you will notice that there are some medicines that you take also that change your heart rate. The normal heart rate stays between 60 is the lower limit and 100 is the upper limit. Most of us have a heart rate of around 70 beats a minute. If you're very athletic, you bring it down to 60 or 55. Just for fun's sake, I'll tell you, not now, some of you who are my age will remember it. When we were young, there was a great tennis star, Bjorn Borg, Swedish star, and I really used to love his tennis. Now, Bjorn Borg, his normal heart rate was 39 beats a minute because he was so athletic. So the more you exercise, the more the heart rate comes down. And you know this both from allopathy and you need to know this from Ayurveda. The lower the blood pressure, the lower the respiratory rate, the lower the heart rate, the longer you live. So there's a direct correlation of longevity with the blood pressure, heart rate, and respiratory rate. People that breathe normally, up and down, slowly, that have heart rate that is usually on the low side, blood pressure that's on the low side, live longer. People that are stressed out, lead a wrong lifestyle, and too much involved in the hustle and bustle, they breathe irregular and they breathe rapidly. Their heart rate stays up because they're anxious, and their blood pressure goes up because they're stressed. And all such people have a reduced lifespan because their propensity to get lifestyle disorder goes up. So how do you then stabilize your blood pressure and lower it? How do you stabilize your heart rate and lower it? How do you stabilize your respiratory rate and lower it? They are beautifully proven scientific practices that actually help you lower these through either yoga, meditation, pranayama, and also all the 9 stress management practices that we discuss in our program. So once you attend the program, you will be able to bring your blood pressure down, you will be able to bring your heart rate down, you will be able to bring your respiratory rate down.
Doctor, maybe you can just brief us through this program, brief 2 minutes on what is that you will be covering in the program.
Correct. So this is actually the core of our program. We call it Dash to Wellness. We want you to immediately go to wellness. DASH is an acronym that stands for D for diet, A for activity and sleep, S for stress management, and H for habit change. You really have to change your diet. And what is a diet that helps you improve your blood pressure and lifestyle disorders? We discussed with you in detail. There is a diet that increases inflammation in your body, and there's a diet that heals your body. So if you go to healing diet that we discussed, you'll improve. Activity burns calories, so you lose weight, and also you improve functions of various organs of the body. Equally important is sleep. You have to have 7 hours of good sleep. We go through one full session on what I call sleep hygiene. Most of us do not know how to sleep, how to go to sleep, what to do before you go to sleep, and we discuss that in detail. Stress management. We are all stressed. As long as we live, we are stressed. But how do you prevent the stress from damaging your body? How do you prevent the stress for putting in cortisol, adrenaline, and noradrenaline in your blood and cause the problems, the medical problems? That is what we discuss in detail. We have 9 proven stress management practices that over a period of time lower your stress in life and modify your lifestyle disorders. All these things require the diet, activity and sleep, and stress management requires a change in your habits, the way you do things. And you'll be surprised to know that habit never dies. You can suppress it, you can supplant it, you can replace it, but you can never kill it. So what is the science behind habit change? That is what we discuss in detail. Even a small change in your lifestyle that you need to bring, the science tells us needs 60 to 256 days. So how do you then potentiate this habit change is what we discuss in detail in this program. Habit change is not easy. If you just tell a person, quit smoking, he never quit smoking. You must have known that blaming, shaming, ridiculing, insulting, punishing somebody has no effect on quitting smoking. Now, for example, a lot of people think, oh, I told my husband, if you keep smoking, you will die of cancer. He already knows it. He knows it, but he cannot help. Why? Because that is how the habit is. Habit lives in the brain in a certain way that is difficult for you to change. So unless you understand the nuances of the science behind habit change, you cannot change habits. And we discuss that in detail in one full session on habit change. So along with it, we also feel that the activity that brings in the most benefit in your life is the yoga, meditation, and pranayama. So you're doing these scientific sessions, and in the same sitting, you're also doing 45 minutes of live yoga, pranayama, introduction to guided meditation. So this is the whole package. 90 minutes of each session that you attend, 45 minutes is spent on the scientific things that I told you and the question answers, and 45 minutes you'll be doing live yoga, pranayama, and meditation. And you do this together, and that is how you change your lifestyle, and that is how you prevent the lifestyle illnesses.
Thank you so much, Doctor, for explaining this. And some of you might be thinking, how do we join this program? Just visit www.myiwsp.com. You have this website detail in your chat box. You can just get into that. You also have the contact number in the chat box. And we will also circulate these details to your email IDs after this call, along with the recording, the video recording. You can view it multiple times, and you can join this program to get benefit. There are close to 800 to 900 people already benefited out of this program. So we have an e-module for this. The course is available in e-learning. You get the moment you enroll, you get a participation, you get a unique password, username, and then you have a mobile application. It works in both iOS as well as Android. You can view it any number of times, one full year. Plus, that is a very important thing is because it's an e-module, you read it, you understand it, but you may have some questions. That is where every single week, Sunday morning, India time, 6 to 7 a.m., we connect live session with Dr. Susheel and with Dr. Swami Dayadhipananda. Together, we'll address all your questions clarified. So every week we connect. It's a health coaching. This is unique. You never see this in any programs, because our objective is just to make sure that you transform your lifestyle. So every week we connect and we handhold, we coach. Any questions when you go through in that previous sessions, you can ask those questions. Also, Dr. Susheel will come with some new health related topics in those weeks for 10-15 minutes, and then we do a 15 minutes of guided meditation with Swamiji, followed by any Q&A sessions. That is the uniqueness of this program. You are not just given access to the e-module and left alone. No, it is not going to be like that. It is going to be hand-holding for one full year. So with this, these are the helpline numbers. You can note it down. We will also be sending these details to you. Please do join and get benefit. It's a very, very, as we said in the previous first video, It's very, very nominal money that we collected just to run the program, keep running it and reach out to maximum number of people. We also open to conduct these sessions for corporate companies in a very marginal price for their employee wellness programs, health and well-being programs. We are open to do that as well. So anybody who's existing IWSP participants, if you are working in an organization, please do connect us with your HR. We will take it further. We do have a dedicated person handling only that aspect of connecting with corporate. So he's also part of this call. He will take it further. So we look forward to join the program if you have not done already. If you have already joined, we look forward to connect us with many other people so that many people get benefit out of it. The objective is to more number of people need to get benefit out of it. So with this, I'll just check it out if there is any question.
There are two more questions, so I'll take those. First,
Yes,
I'll
sir.
take this from
Yes,
Jay.
doctor.
Please give info on dynamic resistance and isometric resistance. So those of you who go to gym know these two types of resistances. Those who do the weights, when you do the weights, in some weights the muscle length stays normal and the resistance increases, and in some the resistance stays normal and the length of the muscle increases. Now this is for those who go to gym, they have to understand this. But in our program we recommend yoga. So when you do yoga in various poses, for example, when you do your Surya Namaskara, you go down on your arms and legs, and then when you do Bhujangasana, or when you do the downward dog pose, all these things, you are actually supporting your whole body weight on your arms and legs and different muscles and back muscles. So when you do yoga, you don't have to worry anything about what is dynamic resistance, what is isometric resistance. In the yogasanas that you're doing with us, you're doing everything. And the beauty of yoga is, you know, when you go to gym, you have to consult an instructor. He'll tell you how much weight you can lift and how to go, and all those complicated algorithms he'll take you through. Simple. In yoga, you only support your body weight. That's it. And this is how the yoga poses are. The yoga poses are designed so that you only support your body weight. You're not lifting any weight there. And that is the beauty of yoga. So if you do yoga and you do the yogasanas, Surya Namaskaras, Bhujangasanas and all those, you are doing dynamic resistance and you're doing isometric resistance, and you don't need to spend too much time in knowing exactly what is what. I hope that answers the question. And there was one more question from Sumanji. What to do with somebody who has high heart rate and is taking darifylin. So I have two things to say here. For example, darifylin taken orally is a very poor bronchodilator, very old-fashioned medicine. Probably nobody no longer uses it. Please consult a pulmonologist and see if he can put you on inhaled medications for bronchitis and emphysema and bronchial asthma or spasm. And once you go on inhaled medication, you can stop darifylin. Yes, it is a side effect of darifylin. It will increase your heart rate. Okay.
Thank you so much, Dr. Sharma. It was wonderful listening to as usual. It was a great session. You had a lot of insight on this subject. Look forward to meet you all. In 2 weeks from now, we will do, this is a series of talk. In 2 weeks from now, we will be having another talk, which is going to be either on heart or a, diabetic. So we will be keep doing these kind of talks. Again, request all of you to cascade it to all the people you're near and dear. Let them join at least this course and understand what is BP, what is diabetic, what is heart issues, so that it will give them a little more. Knowledge is important. Only then they will be able to take the next step. So we'll keep continue to do that. We'll keep connect with all of you. So look forward to see you again in another webinar. More importantly, look forward to meet all of you in Holistic Wellness course. The details are given. So please do connect with us, and we will meet again. Thank you so much, Dr. Sharma. Thank you so much, Karthik, Anirban. We'll meet again in next session. Yes, Doctor?
Thank you, Nareshji. Thank you, Karthik and Anirban, Subratoji, for great help in running the program. And thank you all for joining us. And if you have any more questions, please do not hesitate to ask. And look forward to being with you for a long time. And happy health to you, and hope you do not suffer any lifestyle disorder. Thank you.
Thank you, Doctor. With this, we'll close for today's session. Have a good night and have a great day. Bye. Take care.